Gentlemen, before you scroll past this video, I need you to stop. Because what I am about to share with you in the next few minutes involves something sitting in your bathroom right now, something you have touched every single day of your life, and I promise you, you have never used it like this. Stay with me. This is going to change everything. I'm Dr. Hana, a urologist with over 30 years of experience helping men like you regain their energy, performance, and vitality. If you're new here, welcome to the channel. Before we go any further, if you're serious about protecting your prostate, staying strong, and living without fear, hit that subscribe button and turn on notifications. I share real information backed by real science for men just like you. And if this topic matters to you, type 1 in the comments and tell me where in the world you're watching from. If not, type 0 so I know how to help you better next time. Now let's get into it. Let me paint you a picture. A man walks into my office. He is 64 years old. He is fit, he is sharp, he is still working, still sharp in the mind, still showing up for his family every day. But he sits down across from me and he cannot make eye contact. He stares at his hands. And after a long pause, he says, "Dr. Mori, something is wrong with me. I don't feel like myself anymore." I have heard some version of that sentence more times than I can count. Hundreds of times across 3 decades. And almost every single time, the man sitting in front of me is not broken, not diseased, not beyond help. He is simply running on a signal that has gone quiet. That is what today is about, waking that signal back up. And here is what makes today different from every other video you have probably watched on this subject. We are not talking about pills. We are not talking about pumps. We are not talking about anything you need to buy, order, or schedule a procedure for. We are talking about a technique you can perform in your own bathroom tonight with nothing more than a soft bristle toothbrush and 30 seconds of your time. I know what you are thinking. Dr. Mori, you have officially lost it. A toothbrush. But stay with me. Because in 30 years of clinical practice, this is one of the most surprisingly powerful tools I have recommended to men over 60. And the science behind it is genuinely fascinating. But first, I need to explain something that most doctors never take the time to explain. Because if you do not understand the why, you will not do the how correctly. And that matters enormously here. Let us talk about what is actually happening inside the male body after 60. Most men assume that the decline in sexual performance, energy, and circulation is simply about blood flow. They think if I fix the blood, I fix the problem. And that thinking is not entirely wrong. Blood flow is deeply important, but it is only half the story. Think of your body like a city. Blood is the traffic moving through the roads. But traffic does not move on its own. Someone has to control the traffic lights. Someone has to open the roads, give the green signal, and tell the cars where to go. In your body, that traffic controller is your nervous system. And specifically, for men dealing with circulation issues, sluggish performance, or reduced sensitivity below the belt, the traffic controller that matters most is a nerve you have probably never heard of. It is called the pudendal nerve. Say it with me, pudendal. Because after today, this word is going to mean something to you. The pudendal nerve is the primary communication cable between your brain and your entire pelvic region. It runs through your perineum, which is the area of skin between your scrotum and your anus, and it branches out to supply sensation, muscle control, and circulatory signals to the penis, the prostate, the pelvic floor, all of it. When this nerve is firing properly, when the signal is clean and strong, your brain receives a clear message and responds by opening the blood vessels and flooding the pelvic region. That is what creates firmness, sensitivity, and the response many men over 60 feel slipping away. But here's what happens as we age. The pudendal nerve, like any communication line, can become what I call dormant. It does not disappear, it does not break. It simply gets underused, desensitized, quieted. Think of it like a road that rarely sees traffic. Over time, the surface degrades. Weeds grow across it. It is still there, but it no longer functions the way it once did. What causes pudendal nerve dormancy? Prolonged sitting, cycling, lack of targeted stimulation, years of poor circulation. All of these things gradually reduce the clarity of the signal. And when the signal gets weak, the brain does not respond the way it used to. This is why men over 60 so often report that even when they want to perform, even when the desire is there, the body simply does not cooperate. The want is there, The wiring is the problem. And that, right there, is exactly why the toothbrush matters. Stay with me here, because this is the part of the video where I need your full attention. We know from clinical literature, including research published in the Journal of Sexual Medicine, that perineal stimulation, targeted stimulation of that area of skin sitting directly above the pudendal nerve, can trigger what researchers call a reflex response, a cascade of nerve activation that clears the signal, wakes the pathway, and prompts the brain to respond with increased blood flow. The perineum is one of the most nerve-dense patches of skin on the male body. It is also one of the most ignored. Most men scrub it in the shower and move on. They have no idea they are walking past a biological switch every single day. Now, why a toothbrush specifically? Your fingers, as useful as they are too broad. They apply uneven pressure. They cannot create the kind of precise, consistent stimulation frequency that we are looking for. A soft bristle toothbrush, on the other hand, creates a very specific textural vibration when moved across the skin. That particular vibration is ideally suited to gently activate the surface nerve endings of the perineum without overstimulating them. It is precise enough to target the right receptors. It is gentle enough to avoid triggering pain or defensive muscle contraction. And it is consistent enough to hold the activation for the full duration we need. In plain language, the toothbrush bristles speak to the pudendal nerve in a language it understands. And the pudendal nerve, in turn, speaks to your brain. And your brain, for the first time in perhaps a long time, listens. Now, before I give you the exact protocol, I have to talk to you about the 4 mistakes men make when they first try this. Because I have seen these mistakes in my practice, and I do not want them to cost you results. Mistake number 4, aggression. The more the better trap. I understand the impulse. Men are problem solvers. If something is not working, we apply more force. But the pudendal nerve is not a stubborn jar lid. It does not respond to force. Pressing the toothbrush hard into the perineum, scrubbing aggressively, will do the opposite of what you want. It triggers pain receptors. Your body interprets pain as a threat. It tightens muscles, constricts blood vessels, and shuts down the very response you are trying to create. Light touch only. Please. Mistake number 3, using the wrong brush. Go to your bathroom right now and look at your toothbrush. If it says firm or medium on the packaging, it is not suitable for this technique. The skin of the perineum is significantly thinner and more sensitive than the skin on your palms or your back. Firm bristles will scratch and irritate. Irritation creates discomfort. Discomfort activates your stress response. And a stressed nervous system will not allow blood to flow freely. You need soft or extra soft bristles. A $1 toothbrush from any pharmacy will do the job perfectly. Mistake number 2. Going too long. Several of my patients have told me they tried this for 10 minutes, expecting better results from more time. What they actually did was deplete the nerve signal. The pudendal nerve is sensitive to repetition. If you stimulate it for too long with the same motion, it adapts, the way your brain tunes out background noise. The sensation becomes invisible to the nervous system. What we are going for here is a spark, not a bonfire. 20 to 30 seconds is the optimal window. Mistake number 1. The wrong mental state. This is the one most men never consider, and it is the most important of all. Your nervous system operates in 2 primary modes: sympathetic mode, also called fight or flight, and parasympathetic mode, also called rest and restore. Erections, blood flow to the pelvis, sexual response, all of these live in parasympathetic territory. If your brain is in sympathetic mode, if you are stressed, anxious, distracted, or simply thinking about your to-do list, your body is flooded with cortisol and adrenaline. Adrenaline physically constricts blood vessels. It redirects blood to your legs and arms, preparing you to run or fight. You could perform this technique perfectly in every physical way and get 0 results if your mind is not present and calm. We will talk about how to fix this in just a moment. This is the point in the video where I want to pause and check in with you. If you are finding this valuable, if this is finally giving you an explanation that makes sense, please take 2 seconds and hit that subscribe button right now. I put out videos like this regularly, real clinical knowledge for real men, and I do not want you to miss a single one. All right, you now understand the nerve. You know the mistakes to avoid. It is time for the protocol. This is what I call the 30-second spark, and here is exactly how you do it. Step 1, setting up for success. Choose a private moment. This sounds obvious, but it matters deeply. Privacy removes the stress of interruption. You want to be relaxed, not rushed. You can do this standing or sitting at the edge of your bed or chair. You simply need comfortable, unobstructed access to the perineum. Step 2. Locate the target zone. Without the toothbrush, use your fingertips to gently locate your perineum, the soft bridge of skin running between your scrotum and your anus. It is approximately the size of a large coin. Some men feel a slight ridge there. Others feel smooth skin. Either way, that is your target. That is where the pudendal nerve sits closest to the surface. Step 3. Positioning the brush. Take your clean, soft bristle toothbrush. It should be dry or gently warmed, not cold. Cold temperature can cause involuntary muscle contraction, which is the opposite of what we want. Place the bristles gently against the target zone. Do not press. Simply allow the bristles to rest against the skin, just the weight of the brush itself. Step 4. The dual motion. Here is where the technique comes alive. You are going to alternate between two specific movements. Movement A, microcircles. Move the brush in tiny, slow circles, no larger than the size of a pea. Feathery. Barely there. 5 seconds. Movement B, light tapping. With the same minimal pressure, gently tap the bristles up and down against the skin. Not scratching, not pressing, just soft rhythmic contact. 5 seconds. Alternate between these two movements for the full 30 seconds. The reason we alternate is important. Nerve endings adapt quickly. If you repeat the same motion, the brain begins to filter it out like background noise. Switching between circle and tap keeps the signal fresh and active. The pudendal nerve stays engaged. The message to the brain stays loud. Step 5. The timing window. This technique is a priming tool. It is not a treatment in itself. It works by creating a window of heightened nerve sensitivity and increased blood flow. That window lasts approximately 2 to 5 minutes. So this technique should be used 2 to 5 minutes before intimacy, not 20 minutes before, not an hour before. Right before. Warm the engine just before you drive. Now I promised you a pro-level edition. And this one is grounded in a physiological principle I teach every man who comes into my practice. The technique becomes dramatically more powerful when you pair it with controlled diaphragmatic breathing. Here is why. Remember those two modes I mentioned? Sympathetic and parasympathetic? Deep, controlled belly breathing is one of the fastest known ways to manually shift your nervous system from sympathetic to parasympathetic. When you breathe this way, you lower cortisol, you reduce adrenaline, and you physically signal to your cardiovascular system that it is safe to dilate blood vessels and increase regional blood flow. While you perform the 30-second toothbrush stimulation, breathe like this. Inhale slowly through your nose for a count of 4. Let your belly expand outward, not your chest. Hold gently for a count of 2. Exhale slowly through your mouth for a count of 4. Let everything release. Do this for the full 30 seconds of the technique. What you are doing is combining a targeted nerve stimulus from below with a nervous system reset from above. The toothbrush wakes the nerve. The breathing clears the brain's resistance. Together, they create a two-sided approach that has shown remarkable results in men with mild to moderate circulatory and erectile challenges. Many of my patients report feeling a tingling warmth or a gentle stirring response within those 30 seconds. Some feel it almost immediately. Others notice it building slowly in the minutes that follow. Every man is different, but the mechanism is the same. Before I close today, I want to step away from the clinical language for a moment. I want to talk to you as a person. In 30 years of urology, I have sat across from thousands of men who felt ashamed about what was happening to their bodies. Men who had spent decades being providers, protectors, leaders, and who felt blindsided by the changes that came with age. Men who stopped initiating intimacy not because they stopped wanting it, but because they were afraid of disappointing their partners. Men who quietly began to believe that this chapter of their life was simply over. I want to say something to every man watching this right now. It is not over. Your body is not betraying you. It is asking you for something different. It is asking for more attentiveness, more targeted support, more understanding of how it works at this stage of life. That is not a weakness. That is wisdom. The men who walk out of my office with real results are not the ones who found a magic pill. They are the ones who took the time to understand their own biology and who committed to small, consistent, intentional actions. Those are the men who still report active, satisfying intimacy in their 70s. Those are the men whose partners say to me, "I don't know what he's doing differently, but keep it up." Those are the men who walk back into my office standing tall. Intimacy is not a luxury reserved for the young. It is a biological and emotional need that carries value at every age. It improves heart health. It reduces cortisol. It deepens the bond between partners. It gives men a sense of aliveness that nothing else quite replicates. You deserve that. At 60, at 70, at 80. You deserve that. So here is what I want you to do tonight. Go to your bathroom. Find your softest bristle toothbrush. Spend 30 seconds on the technique I walked you through. Pair it with the breathing. Do it with intention and presence and a willingness to believe that your body still has more to give. Because it does. All right, let us do a quick recap of everything we covered today, because I want this information to stay with you. We started with the pudendal nerve, the main communication cable between your brain and your pelvic region, and how neural dormancy quietly shuts down blood flow and sensitivity in men over 60. We talked about why the toothbrush specifically creates the right kind of stimulation frequency to wake that nerve without triggering pain or defensive responses. We covered the 4 critical mistakes: aggression, wrong bristle type, going too long, and being mentally disconnected, and why each one kills the result. We walked through the full 30-second spark protocol, step by step. And we layered in the diaphragmatic breathing component as the amplifier that shifts your nervous system into the right mode. That is a complete system, and it is yours for free tonight. Try it, and then come back to the comments and tell me how it went. I read every comment. I respond when I can, and I genuinely want to know your experience. Type "it worked" if it did. Type questions if you have them. Your story may be exactly what another man needs to hear to finally take action for himself. If this video added value to your life today, please give it a like. It helps this information reach the men who are out there right now searching for exactly what you just found. And if you are not yet subscribed, this is the moment. Hit that button. Turn on notifications, because next week I am going into something that almost no doctor talks about openly, a specific morning habit that directly impacts prostate health overnight, and it is even simpler than what we covered today. You do not want to miss that one. I am Dr. Hana. Thank you for spending this time with me. Take care of yourself. Take care of the people you love, and I will see you in the next one.